Hello there, and welcome to Healthcare Innovation's March Digital Health virtual event, the Cybersecurity Virtual Day. My name is Matt Rayner. I'm the publisher here at Healthcare Innovation, and we are so excited for today's event on all things cybersecurity. Whether you are watching this virtual event with us live here on March the 30th or consuming this content on demand, a big thank you to you, our Healthcare Innovation audience, for being a part of this event with us. We have two fantastic sessions, which we are really excited for today. And we will be kicking things off shortly with a panel discussion entitled Cybersecurity, Biggest Threats, Biggest Opportunities. Now, before we get started on this opening session, I want to encourage you, our audience, that if you have any questions of our faculty today, to utilize the chat section within this virtual event platform, and we will do our very best to get to any and all questions of our audience today. With that said, I would love to officially kick off our Cybersecurity Virtual Day by welcoming on our editor-in-chief here at Healthcare Innovation, Mark Hagelin, who will be serving as our moderator today. Mark, the virtual floor is yours.
Thank you so much, Matt, and welcome to you in our audience, both today and in the future. I always love to welcome people in the future. In any case, it's really great to have you here. We have several sessions today, and our first one is a panel on the top threats and opportunities in cybersecurity. I am going to introduce our panelists. I'm just going to say, if ever there were a moment when we should be paying attention, now would be the moment. We know that there are state actors involved. We know that there are others involved in cybercrime right now. And it feels like a moment of great threat, but in that there is opportunity for CISOs, CIOs, and others to really up their game and prepare their patient care organizations to move forward with alacrity to ensure the greatest level of security that they can possibly develop. So I am going to introduce our panel, and actually I'm going to ask each panelist in this order to introduce himself, briefly, title, role, and organization. So it's my pleasure to welcome Francois Baudouin, Seth Fogarty, Andrew Markloff, and Dan Cinnamon. Welcome, gentlemen. Great to have you all here. Francois, why don't you go first? Just tell us about yourself for a moment.
Sure. Good morning, everyone. My name is Francois Baudouin. I am the Technology Director and Information Security Officer for Inspira Health. Inspira Health is a hospital system in southern New Jersey. We have 3 acute care facilities, behavioral health facilities, and many, many more different sites that we serve. So 5 counties in southern New Jersey.
Thank you, Francois, very much. Welcome. Seth Fogarty, welcome.
Yeah, thank you. My name is Seth Fogarty. I serve as the Director of Information Security for Penn Medicine, a regional healthcare organization, 75,000-ish employees or so. My primary role here is to help with the maintain and manage the security program with a focus on the engineering and architecture primarily. So most of the protect kind of technology stack that is in use across the organization.
Wonderful. Thank you so much, Seth. Andrew.
Yes, hi, I am Andrew Markloff. I am a solutions consultant with LexisNexis Risk Solutions, serving our patient identity linking and cybersecurity groups. So nice to be here.
Thank you so much, Andrew. And Dan.
Yeah, hello everyone. Dan Cinnamon. I'm a solutions architect with Okta. We're a cybersecurity vendor dealing in the areas of identity and access management and digital identity and authentication. So pleasure to be here.
Great. Thank you so much, Dan. Welcome all panelists. Great to have you. So how should we frame the current environment right now in terms of cybersecurity, the intensifying threat vectors, everything that's going on? In our prep calls, we all agreed that the threats are intensifying. What does this mean for the leaders of health IT and health IT security in patient care organizations? How should we look at all of this? We can go in any order, but I think I'll turn to you first, Francois.
Sure. Obviously, we're under attack and the attacks are increasing. I can tell you that a year ago, our IDS was thwarting about 2 million attacks, and right now we're at 3 million a day. Okay, so obviously this is automated and it protects us, but there are always attacks that go through, end up on the firewall, and the firewall does its work. But I think those attacks are increasing in number at the same rate. One thing that has changed a lot is in the past year, we have seen a lot of reports on TV by the press on cybersecurity. And what it does, it raises the awareness of cybersecurity with the board, which means we get a lot more questions from the board. So that is also a major change in what we're doing. But I'll let the team respond.
Yeah, and I'm going to go to Seth, but first I just have to say that 3 million a day is just a mind-blowing statistic. I mean, there's no way around being mind-blown. Seth, your thoughts?
Yeah, I would agree with everything Francois said. And you know, I've been doing this security stuff for like 20, 25 years now. And you can just see the evolution changing and the pace changing, and even the scope of the complexity and the way that attacks are evolving. I don't think there's a week that goes by now that we don't see some major exploit that we now have to instantly react to. And it's not just a, one piece of equipment or one piece of software. It's not the standard Microsoft, Adobe, Java, Flash kind of stuff. It's like Log4j. Where did trying to react to really critical infrastructural almost technology threats that exist within our networks that we have to react to and be aware of, and not just have the skills to be able to react, but the resources to be able to react. And that's at an enterprise level, including the rest of IT that now has to kind of absorb all this extra influx of work. So it definitely is a growing threat world out there, but that a threat world goes beyond just the people in this call too.
Yeah, absolutely. And Andrew, what are your thoughts on this?
So, I mean, obviously, I agree with the other two gentlemen that it's a very scary landscape right now. I think that healthcare historically has been a little bit slow on the IT side to react to cybersecurity threats. Hence, you see the ransomware attacks that have been happening around the provider and the hospital system space. Largely, it's a little bit scary to us that we are sort of a sitting target as a healthcare community, right? That financial data and the traditional data breaches that you've seen are almost reaching a saturation point, where a lot of that financial information and the personally identifiable information is almost commoditized, right? So what's scary to me as we look around and across the landscape is what's next. So obviously the weak point in everyone's cybersecurity efforts is always the human being on the other side of the computer. And that's something that's not going to change, right? Social engineering attacks and things like that are just becoming smarter and more prevalent. They're coming in from different streams, whether that's text, email, phone, in-person scouting, right? Spear phishing, things like that. So it's a scary world we're living in these days.
Yeah,
absolutely. Dan, would you like to add?
Yeah, certainly. Yeah, to add on to that, I think what I'm seeing, from my point of view is, these past couple of years have really forced organizations to accelerate some of their efforts in, omni-channel experiences, right? Remote health, providing more services, remotely in different ways. And so I think my concern around all of that is, how do we extend the assurance levels that we get in a brick and mortar environment to those other experiences, right? So I think, as Andrew said, if I call a provider and they use a knowledge-based assurance, to authenticate me, to know that yes, I am the person I say I am, and all of that information is now commoditized. I mean, I think that we need to sort of reevaluate what level of assurance we get in these new ways of interacting, whether it's through a chatbot on a patient portal, or the patient portal itself, or calling on the phone. I think that that's a major area where we need to kind of evaluate and sort of improve the level of assurance that we're requiring in all these different channels.
I definitely agree, Dan. I think it's as we expand the surface, right?
Yes, the surface.
Of interactions, we need to think about that. What's one thing that I have often said, and I'll say once again, cybersecurity is such an interesting element of healthcare because everything else is moving in a different direction. We're sharing more data. As we move further into population health management and care management, the need is to share more and more data and to connect more and more people and organizations. But that inevitably bumps up against our cybersecurity needs, which, in a perfect world, we'd have a castle with a moat and, alligators in the moat. So one of the challenges for all those involved in cybersecurity and healthcare is that we've got these two different phenomena going on. And that makes it challenging. We can't, I know that all CISOs, all CIOs, all CTOs know that we have to communicate and we have to share data. So it's not possible to just say, well, we'll shut everything down. Francois, I see your hand is raised.
Yeah, if I may add something on cybersecurity and
Please.
healthcare, we've already identified that the weakest point is the human, and of course it is. But in healthcare, the culture of a healthcare worker is to help people. So if they get a call from IS saying, hey, I need to reset your password, tell me what it is, and I'll reset it for you. Of course, they're going to say yes, unless they went through extensive awareness training. But by default, considering they're very busy and distracted, it makes cybersecurity very complicated at that level because of the nature of healthcare. And it's not a blame thing. It's just we have to be aware of that.
Well, absolutely, Francois. And if I may, I'll just add a story. I remember talking a few years ago with interviewing a consultant who is in cybersecurity, and she's in 3 fields. She's in financial services, healthcare, and the nuclear industry. And I said to her, oh, that's so fascinating. What's the difference between the nuclear industry and healthcare? Obviously, there's a huge difference, but in terms of cybersecurity. And she said to me, well, I'll put it simply, you can't just call up a nuclear power plant, can you? Obviously, for obvious reasons. Whereas I like to tell the classic story, a bad actor, all they have to do is call up ABC Hospital, ask for purchasing, and then say, I need, I sent a package and I think it went astray and there's some problem. Who can I talk to? And they'll say, oh, well, talk to Dottie in purchasing. So Dottie picks up and says, hello, how can I help you? And the person says, well, there was a package, blah, blah, blah. Can I just get your email? I'm going to send you a more detailed note. She says, certainly. So they send the note. But they don't, they send a note that says something like your FedEx package has gone astray. And she says, oh my goodness, well, I must open that email. So there you have the classic, it took one quick call and an email, and 9 months later, the health system gets the message that everything is locked up, pay $25 million. So healthcare will always have that vulnerability because patient care organizations are public facing. So, unlike nuclear power plants, they can't just shut the doors and keep everybody out. In addition, we now have a situation, and I've chosen not to name the most obvious organization here, but we have state actors, we have governments, foreign governments that are also involved, and they're getting very aggressive. And inevitably, there are going to be situations in which healthcare organizations in this country are affected, whether or not that is, purposeful, like we're going to get ABC Hospital in Anytown, USA. It doesn't have to be that. It can be, we're just going to try to slam every, healthcare organization we can. Gentlemen, what do we do about that kind of threat, given that it can be very powerful, and it could be sustained for some period of time, these attacks? Andrew, I know you had a thought.
Yeah. So I think that a lot of that, and those are particularly scary, right? Because in some cases, their only goal is to create chaos.
Yes.
It's a little bit easier to predict the behavior of somebody who's looking for financial gains or something like that. But I will say, I think there's a shift that needs to happen in how people look at their cybersecurity. So in a lot of cases, what they're doing is they're looking at the individual who's logging in, and they're looking at their physical identity, right? Or they're looking at an email, and they're looking at servers and some items that can be tagged on an email coming in. What we really need to do is start focusing a lot more on a digital identity and a digital footprint. So when you're looking at individuals who are emails that are coming in, you can see there's a breadcrumb trail that you can follow, right? You might counter by saying, well, if they can hide their IP, they can spoof, they can do these things. In some cases, yes, but there's still breadcrumbs, right? We can see that they're hiding. We can see that they're spoofing. We can see that there is that according to the operating system of an original computer or a generation computer, we can see how many email addresses are associated to it. So there's ways to look at this, right? And it's really just expanding the scope. If your goal is to identify somebody's physical identity, so their name, address, phone number, social security, that's great. You also need to look at the digital. If you're looking at the digital, you also need to go a step deeper and look at the history of that digital, input. And really, the old saying goes, right? There's two types of companies: the ones that have been hacked and the ones that don't know that they've been hacked. So there's there's no silver bullet perfect way, but the best way that you can do it is to really take a step back and look at it from a more broad perspective.
Yeah, absolutely. Others thoughts on, first of all, I meant to say that actually, Andrew, the problem with the state actors is that, yes, they're going to be about destruction. They're not going to be about, getting $20 million in ransomware. They're going to be about taking down, to whatever extent they can, any assets in our country. I mean, look at Colonial Pipeline, for example, and healthcare could be next. Oh, I see both Dan and Seth. Dan, go ahead, and then we'll go to Seth.
Sure. Yeah, I was just going to say, I think from my point of view, I think a lot of the same basic blocking and tackling of risk management and security applies. However, I think the calculus of it changes a lot, right? Like, so when we look at, the threat vectors and what risks we're taking on, there's always like a cost. What's the cost to the attacker of those? And are there, can the vulnerability actually be exploited by the attacker too? And I think that calculus changes in a huge way for a state-sponsored attack where, yes, it might be a very expensive attack, but hey, they've got the resources for it. I think another major thing is some attacks, like attacking critical infrastructure like DNS or BGP, like routing protocols, some of these things that are like the backbone of the internet that folks like, the random criminals can't really touch. I mean, they can, but it's difficult for them. These folks have access to actually get at some of those. So I think from my perspective, it changes the calculus of, hey, what's possible, and expand the horizon of what risks you're considering, and also reevaluating what your mitigation procedures are, like relying on some of these critical infrastructures. The limitations of those should be understood, is what I'm saying. Yeah,
Absolutely. Absolutely. Seth.
Yeah, the points already mentioned are completely valid. I know in the recent issues that we're dealing with from a world perspective, there were two additional things that caught my attention. For years, we've been in this mental state that attackers are going after money, and follow the money. If there's no money, there's no motive. Now with this recent escalation of world events, we've got these wiper viruses back on the table again. And it's not like that's new, but it hasn't been really, I would say, top of mind. It's not something that we're focused on, and it brings it back into focus. So the concern from my perspective, being on that protecting, I've got to make sure that nothing leaks out into my organization from an organization that is being attacked by that wiper type of virus. So, and it could happen. It could come through USB. It could come through email. It could come through some kind of worm technology that that is layered on top of a vulnerability. So that caught my attention. That's just one area. And on the flip side, I think Dan kind of was touching on a little bit. There's some deeper infrastructural stuff that sits out there, and one way that it was kind of exploited in this particular scenario was the backbone of JavaScript that sits out there, and supply chain attacks is kind of what it will fall under. But I had to have a conversation with our developers and say, are we using any of these particular packages because this particular developer decided to leverage their capability and their access to a fundamental piece of code that's used by multiple, if not, some of the code that guy wrote, I think, was used in millions of different, by millions of different people. But he leveraged it in such a way as a kind of a peaceful activist type of thing, where if you resided in one of the countries that are involved, it would start wiping files. But if you were in the other countries, it would leave a message. So that's another paradigm shift that we really haven't had to honestly face firsthand. We hear about it, but to actually now have to have conversations with developers saying, do we actually have any live dynamic links JavaScript backends?
Absolutely. Francois?
Yeah, so I'm going back to the infrastructure, which was mentioned. Yes, healthcare may be attacked directly, but with that kind of state actors, they may also attack our infrastructures. What does that mean? That means we could potentially lose power for days. We could be losing our ISPs for that matter, which means we lose access to the internet, or we lose access to our data center, our remote data center. So we can't. Yes, we need to. InfoSec is such a vast domain. We're ubiquitous. We're in everything. But let's not forget the outside sources of attacks, which may or may not be as solid as we want them to be, right? So for the WAN, for example, don't have one source, one ISP. You need at least two ISPs so that if one fails, the other one keeps going, hopefully.
Yeah.
Et cetera, et cetera.
Absolutely. I appreciate that, Francois. I'm going to put a URL in the chat. The Cybersecurity and Infrastructure Security Agency, CISA, warned last month that state-sponsored disruptions could occur in all industries in the US. So they have a program called the shieldsup program. And I'm just going to put the URL in the chat. I think that everyone should look this up and just read a little bit about it. I think it's quite fascinating, actually, and hopefully that will be useful. While I type that into the chat, Andrew, you had shared with me and us the term cyber mischief. which I think is a great term. What does that cover? What would you like to say about that concept?
Yeah, well, first I'd like to say that though I would love to claim it, I did not invent that term. It's really something that you're starting to see out there. Some people use it interchangeably with cybercrime, and in a lot of ways that it is, right? To me, it is more of a, what we were kind of talking about, right? A more chaotic sort of attack, approach that's not necessarily looking for money. It's not necessarily looking to make the news. It's not necessarily looking for for these giant waves, right? The first time I heard that term used, it was in relation to an electric car. So the individuals were able to access the computer system for an electric car and turn on the AC or the heat whenever they wanted. Right? Sounds silly, but when you're in an electric car and you drain the battery for 8 hours with a heater or an air conditioner, that's annoying. So that's sort of cyber mischief. The comp for healthcare would be DME, right? And medical devices that have internet capability and things like that. So in a lot of cases, when hackers or criminals are looking to get into some of these devices and even health systems as well, their goal is not necessarily to make themselves $20 million in that transaction. They're just there to cause trouble. So my point in bringing that up is that, to the earlier point, I think it was Seth who spoke to this most, was that you cannot just follow the money anymore, right? You have to make sure, you have to look where you have all these vulnerabilities, where you have all these little access points, because what starts as cyber mischief could become a giant challenge down the road, right? So if it's one thing if you can only control the air conditioning and the heat on an electric car, at some point you'll be able to drive that electric car away from the owner and to yourself. So just opening your eyes to all the different access points.
I know, really, don't even get me started on self-driving cars, but I have some mean thoughts. Dan, I think you probably had a thought about the whole idea of cyber mischief.
Sure. Yeah. I guess from my perspective, I guess what I'm seeing, out there is, I think the closest thing, really, a lot of times I focus on, what's the motive, and I think from my point of view, I think we're past the point where maybe we're doing it for fun, but that doesn't mean we're doing it for money either. So I guess from my point of view, I say, what is the motive then? I think we've got like the activists, like the anonymous group. I mean, they'll do an attack because they'll in protest or like, so I guess from my perspective, there's still a motive, but it's not necessarily the traditional ones. And yeah, you never know, what policy your company might have that someone might take issue with. A long time ago, I worked for an organization in the food industry, and I thought that there was I thought that it was a very, well-run business, ethically ran and everything. And one day I found out that there was a protest against some ingredient that we used. And I'm like, really? Like, I had no idea that there was like a protest against something. And so I see that as something where yeah, like you never know when some group might take issue with something that you're doing, even if you feel like it's a relatively safe thing. And so, yeah, some of the cyber mischief would come up, and would be an additional sort of threat vector for you, threat actor and a threat vector. Yeah,
absolutely. So let's talk for just a moment about DDoS attacks that can bring down entire EHR systems. Francois, I know that you and your team have been working to protect your organization against those.
Yeah, sure. So just real quick, I wanted to mention that Triad that everybody in InfoSec knows, which is confidential. CIA, you remember CIA, you remember the Triad, which is confidentiality, integrity, and availability of information. And that's what we're trying to protect most of it, right? Most of the time. So this is what we base most of our actions upon. DDoS goes to most to availability of information. In other words, if we are under a DDoS attack, that means we lose the availability to some information. For example, availability to our remote data center if we go over the web, or if our ISP is being attacked. So there are definitely things that you can do. I did mention already to have multiple ISPs. The links themselves can have some DDoS protection. We do. And it's being monitored by the ISP, and they're able to take action if we are under a DDoS attack, which hasn't happened yet, but we're ready for that. And then the biggest thing to me is to tabletop this thing, and also to test, and not forget to test with the executives. They have such a huge role into all this, and they have to guide the organization. So we need to test all the lines of communication with them, so they understand what's happening and how to react to it and make the right decision at that point.
Right. I absolutely agree, Francois. And that segues naturally into my next question about the use of advanced strategies. That includes behavioral monitoring, advanced network segmentation, auditing of backups, the engagement of SOCs, security operation centers, and other strategies. Where are we in those? We did a survey. Last few years, we've been doing an annual survey of our readers, and we've found that they're not very far. They're not very far down the road on these things. Where are we, and where should we be? And who would like to begin? Andrew, please go ahead.
Yes, so I had a couple things I wanted to touch on before I'll pass it along to the rest of the group, because we have some really interesting perspectives on it from the actual users to the providers. So as a provider of these types of securities, I will say that they are available. You have a lot of tools that are available to you, and CISOs and executives across any company need to be constantly assessing the available tools that are there for them, right? So if you are not looking at your cybersecurity methodology, at least on a 6-month basis, you're borderline, guilty of negligence, because of the way that the cyber crime and the entire, sort of methodologies of these attacks are changing constantly. The biometrics and things like that, I think I had mentioned them a little bit earlier, seeing, the pathway of the individual or the computer or the machine. You can also see things like, how the phone or the device is being held, how it's being interacted with. There's a lot of things that are out there that are able to be, that are at their disposal. So if the security system is not evolving with the threat, then you cannot assume that it's going to be able to do its job, right? There's too many opportunities out there. You have, in some cases, you're employing artificial intelligence or machine learning. Those are wonderful. You also need people there to look at it and reassess how you're going about it on a regular basis.
Yeah. Seth.
Yeah, this is I think, a fascinating aspect of security, and is going to keep many vendors and also, folks like myself engaged in this for years to come. Just going back to the DDoS conversation, DDoS can occur, or taking away the availability can occur in many different ways. And, if there's an outage, for example, whether it's ransomware, whether it's DDoS, whether it's whatever else it will be, most of the focus is on the immediate. What's the impact? Worst case scenario, ransomware, we've seen it. It takes down healthcare organizations, and you have patients diverted. But with a strategic long-term security hat on, preventing that is more than just the immediate impact. I'll just there are just two different scenarios. So one hospital in Alabama had hit by the ransomware, and there was a mother who came into the hospital system during that event. And because the ransomware event was impacting the ability to provide patient care, there's now a case open that a baby died, and there's a case open because of the correlation between that event and the baby's death. Another, more recent situation, a hospital had ransomware, and well, actually a study was done, and I'll just read this verbatim, but a study showed hospitals in Vermont affected by ransomware attacks during the COVID-19 pandemic reached capacity levels linked with excess deaths more quickly than hospitals not dealing with cyber attacks. So now we're starting to leverage big data to help show the value of having strong security controls in place to prevent things that we would never really be able to put together without having an understanding of big data and the systems to be able to process that, and the intelligence that you can layer on top of that, whether it's machine learning, AI, or whatever else. And in the same time, what Andrew's talking about starts to pull that big data, but now we also have to think about our I'll call it our customer, our employee privacy. So I know there's technologies out there that can practically, tell me, put my, play Minority Report, going back to an old movie, but there's technologies out there that are going to probably tell me that that Lucy in whatever purchasing is a threat, not because she's done anything, but because she did this, and this, and because of all the data that we've collected from all the systems that we're monitoring across the entire, state or nation, that's a pattern that means now she is not just a risk, but she's actually a threat. And what do we do with that? So, you can just extrapolate on this for an hour, probably.
I'll just mention, and then I'll go to Francois and then Dan, but I'll just mention, Seth, that a couple of years ago, I spoke to a very highly renowned consultant in this area, and he talked about a bizarre situation in a hospital in which parents were coming in with their children into the emergency department, and car accidents, all these various things, and then later on they were getting solicited by kind of an ambulance chaser law firm. And the hospital could not figure out how that could happen. Well, it turns out they used behavioral monitoring, and they found that one woman, in admitting, of course, he didn't share her name, not that we would know her anyway, I'll just call her Jane, suddenly was looking up 10 times the number of patient records as everybody else in admitting. And they looked at it and said, that is way strange. And they basically, went to her and she confessed. She was just writing down, handwriting emails, phone numbers of these families. So behavioral monitoring works. Francois.
Sure. Actually, there are vendor security management programs as well as employee monitoring programs that do the job very well at that level. So yeah, we're looking at acceptable risk. Can we fight all the risks out there? Well, maybe we could try, but we probably cannot. However, I think going back to what Andrew was discussing in the beginning was to look at the concept of not so much ROI, but ROSI, which is return on security investment. And looking at new solutions. Those advanced solutions may require a lot of effort for very little added protection to the organization. I'd much rather go back to make sure that everything is done correctly and maybe evaluate what that is being done. For example, backup technology. You have backup technology, which could take you 4 hours or 8 hours to restore your data. And there are some other backup technology like snapshots where you can do that in minutes. So now you look at the investment, you say, okay, business continuity, do I really want to be down for 4 hours, 8 hours, 24 hours while I restore my backups? Or can I set up a technology that allows me to get back up after any kind of attack like ransomware, for example, can I get back up within minutes? And if I can, I think a lot of people would say, yeah, let's do it. But then you look at the investment and you see, okay, is it worth it in our environment? You always have to look at your environment, evaluate it that way.
Yeah, absolutely. Thank you, Francois. And Dan, you wanted to share also?
Yeah, real quickly, I guess the one aspect of this that I think is an opportunity for folks, so from our perspective, being sort of at the user interface layer, right? We're one of the technology areas where the users interact with us, and so I see these sorts of algorithms, behavioral detection, things like that is a little bit of a golden opportunity to both increase security and reduce user friction at the same time. It's one of those areas where you get a little bit of both of those, and so that's something that I think we're just getting started in, frankly. I'd love to continue with that, with reducing friction for those users that are completely within the kind of the normal realm of use, and then looking for higher assurance in those outliers. So
yeah, absolutely. Thank you. So let me ask you all, how might the use of AI and machine learning be shifting the landscape? One can use AI and machine learning to do a variety of things, and perhaps, like in the behavioral monitoring area, but there are other ways as well. Seth, why don't we start with you on that?
Yeah, I mean, it's already impacted. I think probably most organizations are looking at, we'll call it Nextgen AV, if they haven't already implemented it. So, we've come from a world where it was file scanning, some basic heuristics type of scanning, but now we're in a world where it's collecting data and actually tracking what a person's doing. Does it make sense? Do they normally do that? So that's already happening in the AV world. It's going into the firewall world. It's also going into the email world. So now you can, instead of having a traditional spam solution, there's solutions out there that are built around, this CEO has never received an email from this IP address. And I think Andrew kind of hit on this in one of the earlier points he was making. Why would he be getting that now at 9 o'clock at night when it's never happened? The risk score just keeps ticking up, and just based on the behavior of that email, it now is a smarter solution instead of just a raw pattern matching solution. So in any of the areas that are traditional pattern matching type of technology, this is a technology that's changing those, and it's not SIM, AV, firewall, identity management, MFA, there's elements of that in there too. So I think that we're going to see a lot of that.
Absolutely. Francois.
Sure. So I'll just give an example of where AI is changing things. I think it improves the detection of attacks to a faster response, and actually finding out that we're under attack, what we may not know, by being able to correlate different logs from different systems and realizing that maybe one incident at one level doesn't really mean much, but if you add it to this couple more incidents to other systems, now all of a sudden you'll realize that you are under attack, and AI helps tremendously with that.
Yeah, absolutely. So what are the key things that we need to do around identity management going forward? And Dan, I know you had some thoughts on that.
Yeah, just in terms of what I'm seeing a lot of, in my conversations with customers and prospects, what I'm seeing a lot of is, a lot of organizations have they've started their digital transformation journey. They've started to roll out technologies to have better engagement with their customers, and that's wonderful. However, I think a lot of them have kind of reached that point where they want to do more, but there's a little bit of a struggle, right? So, because identity is sort of at the forefront of a lot of that, right? We need to know who you are first, and before we can provide a seamless experience. So, for example, I'm seeing cases where maybe an organization wants to get to know a person before they're a patient, right? And if your identities are all in the EMR, there's struggles there, right? So the use cases for identities are broadening beyond what they maybe started as, right? So, there's a lot of struggles with getting out of the silos and into sort of abstracting identity into its own thing that can then serve multiple business units, and allow maybe some cross-selling, amongst business units, allow for better engagement with people, whether they're a patient or not. A lot of those things are challenges that we're just getting started in solving, I would say. And then of course we mentioned too, how do we actually provide assurance across all of those things? If we have multiple, business units, multiple products that we're rolling out to, folks, maybe new audiences, things like that. How do we extend some of the assurance levels to those, and also offer seamless access, to all those, the new engagement use cases and things like that. So that's what I'm seeing a lot of. And so that's where, we as an identity company have been working to help sort of abstract that out and provide that more global, flexible access. So
Yeah.
that's what I'm seeing out there. Yep.
Yeah. Oh, great. Thank you so much for that
Yeah.
report. Andrew, you wanted to share something.
Yeah, so just in relation to your identity management, right, I see it as a couple different fronts. The first of which is obviously identity management for the purposes of access management. So that goes back to what I was talking about earlier about the concept of a physical and a digital identity, right? So it's important to look at both of those things. Multi-factor authentication isn't good enough on its own. Knowledge-based authentication is not good enough on its own. Being able to go back and reference and look at that physical identity and see whether there's been fraudulent activity or crime associated to that identity is wonderful. It is also not enough on its own. So that's why you really need to look at the digital history of the individual or the device that's coming into. The other side of it is the actual identity management and patient data management and linking and best practices, right? So everybody understands the concept of as little data as necessary, as slim a file as necessary. But there's also the idea that the P in HIPAA is supposed to mean portability. So everybody has their data locked down in such tight vaults because they're so scared of these data breaches that they in a lot of ways, and this is all, looking like it's going to be changing over the next couple of years. But I will say that greater use of tokenized or de-identified data throughout a healthcare organization is an excellent way of mitigating risks, right? So if you can reduce your exposure and your transport of that data and the people who have access to that data significantly by tokenizing or de-identifying that data and allowing only the very core folks who need access to that data in its identified form access to that. Anybody else who's doing any sort of data management or lookups or things like that only needs to see very specific small slices of data, and they don't necessarily need to see an entire record. They don't necessarily always need to see, links across different data sets to get, to potentially marry something like claims and identity data, right? So that's kind of how I see it, increased view of the digital identity as well as the physical identity, and also increased utilization of de-identification tools like tokenization.
Good advice. Good advice. Thank you. We have just a little bit of time. We've had such a stimulating discussion. It's been great. Let me ask everyone, what do the next few years look like in this landscape as we go forward? And then we'll close by asking advice. But first, anyone who would like to, what do the next few years look like?
I'll jump in, I guess. I think I've already touched on a little bit. I think big data is going to probably come to its maturity in this field and continue to grow in the ways it can be used. I mean, you can see it in how healthcare is using, healthcare itself is using big data to provide smart, timely, and focused healthcare services to people who didn't even know they were in need. but now find out that they are in need. And that same kind of principle applies to the security field as well. I mean, I appreciate what Francois says. Understanding how that risk is going to play out and where the cost of it, and proving the value of all the stuff we can do with big data is going to be probably the biggest challenge in that. It's not that the technology is not there, it's just making sure that it's reachable and reasonable to implement. I'll let others weigh in now.
Yeah, important. Dan, go ahead.
Yeah, so I think from my perspective, and I've been sort of in the thick of this with some of my customers, is implementing the standards and protocols necessary to comply with the Cures Act. So having interoperable patient data APIs is something that I think is going to be taken advantage of a lot more in the next few years. I think we're going to see a lot more apps developed, a lot more new ways that patients can interact with their data, because it is going to be far more accessible without a proprietary technology, something that's widely available. And so I think that we don't even know what it is yet, because clever startups will come up with their new ways of enabling access to data. Unfortunately, I also think that's going to open some new attack vectors, as companies are new at having some of these interoperable APIs. And so also, I think, unfortunately, there's going to be some exploitation of that we have not yet addressed yet. So I think both good and bad in that area.
Yeah. Thank you. Francois?
Yes, totally agree with both comments about big data. I mean, I can see it in my enterprise, where the data is being transformed into real actionable information, dashboards, etc. And in the next couple of years, what I see is a much bigger emphasis on cyber war. I do think that the cyber war may or may not have already started. Probably has already. It's definitely between other countries than the United States, and that's being reflected right now with the current events. But we are not immune to this, and we are under attack constantly. We're also attackers. Let's not forget that. So, to me, the next couple of years, we're going to see much more activity at that level.
Yeah, absolutely. We have just a few minutes, but I would love for each member of our panel to offer one piece of advice to our audience based on everything we've talked about. And of course, it can be any kind of advice, including don't wear mismatched shoes, but hopefully it'll be cybersecurity focused. Who would like to begin?
I can begin if you want. I could say so many things. What I will say is get involved at every level. And that means be aware. If you see something wrong, do something about it. Don't let it go. Get involved in groups like InfraGuard, for example, where you protect the country, you protect the infrastructure of the country, you get involved at that level. Get involved in security groups, participate just like we're doing right now. To me, that is so important to raise the awareness of CEOs, CISOs, et cetera. Not that CISOs are probably aware of everything that we're saying, but definitely CEOs, CFOs, I think they need to understand all this. So get involved. It to me is my best piece of advice.
Good advice. Thank you. Seth.
Yeah, just to piggyback off Francois, it's don't forget what got you into this field. We're all headed for burnout city if we don't remember the passion that got us here, and to keep that in mind. And getting involved is one way to keep that momentum going and to keep the focus.
Also, very good advice. Andrew?
Yeah, I would just say, we equate the lifespan of a cybersecurity model and implementation to the lifespan of a cell phone. So as you see the technology grow and change in cell phones in 1, 2, and 3 years, and by that point, the cell phone is out of date, that's a pretty good marker of where your cybersecurity implementations are. So stay vigilant, keep addressing it, keep looking at gaps there. Sometimes there'll be nothing to change, but you know, you want to be proactive and not reactive.
Absolutely. Dan, do you have any thoughts?
Yeah, I think that the best advice I could give would be, you know, as I mentioned, you know, that sort of assurance level, assurance model. You know, there's one of the NIST standards out there, the NIST 800-63, that really talks about, you know, it lays out a framework for both the like identity assurance level, but also like the runtime authenticator assurance level. And so I guess my advice would be to sort of have an analysis of all of your member, patient, customer interactions, and each one of those sort of understand what level that are you at, and what level would you like to be at, and maybe take it from there. And so that would be sort of my advice, because I think there's some really great content in that NIST standard around, you know, all those assurance levels, and you know, how much did each level be relied upon,
Yeah,
so to speak.
I absolutely agree. And I want to reinforce that and support you by saying, Dan, that to our audience, that one of the things that we're finding in our reporting and speaking with experts like all of you is it's a little bit shocking how unanalyzed the situation is in many patient care organizations. People think that if they're just following a few simple guidelines in general, that they've got it all nailed down, and they just don't. And I think one of the key elements here is the fact that the threat vectors are intensifying. We simply cannot rest, sadly, that we can't rest. And to close, I'll just say I think that I can see this from both angles, and I am generally a glass half full person. On the one hand, the threat vectors are intensifying, and I do think the entry of state actors will also make this a much more perilous time going forward. That said, the good part of this is we are seeing more and more organizations, first of all, hiring CISOs. We're over 50% now, thank goodness. And then giving them some budget and giving them some staff so they actually have things to do and people to do them with. And the very notoriety of everything that's going on is changing things a little bit. We in contrast to even a few years ago, I think everyone realizes this is a real thing. This is not just some kind of abstract, you know, sci-fi threat. It's happening to patient care organizations everywhere. So that's the good news, that more and more organizations are realizing it. And I think one of you mentioned the fact that you know, the boards are very aware now. You know, hospital and health system boards are made up of people who are often business and community leaders. They are, and they read newspapers and watch TV, and they're seeing that this is becoming a really important thing. So I hope that in the next few years that everyone will really move forward with alacrity to really put into place the best systems and the best processes possible, because cyber attacks are inevitable. So we need to be able to prepare for them. So thank you all so much, Francois, Seth, Andrew, Dan. This has been an absolutely terrific discussion. Thank you for your expertise. We really appreciate it. And with that, our publisher, Matt Rayner, has returned.
Yes, thank you, Mark. I'll echo what you said. A big thank you to our panelists for a fantastic opening session to kick off our Cybersecurity Virtual Day. Our next session is a fireside chat on the rise of ransomware attacks on healthcare organizations, excuse me. And that session is available to view right now within our event website. So you can go there now to view that session or watch it at any point over the next 30 days. We hope you enjoy. With that said, a big thank you again to our panelists, a big thank you to you, Mark, and a big thank you to our audience for participating in this Cybersecurity Virtual Day. Take care, everyone.
Thank you.
Bye-bye.